Welcome to the campus of North Idaho College and today's broadcast of the North Idaho College Public Forum. The crew is comprised of North Idaho College television students. Your moderator is North Idaho College political scientist Tony Stewart.
Today we wish to discuss with you what is a very, very important topic that's being discussed all over the United States on numerous television programs and also on the print media. Our subject today is the issue of AIDS, or it's also known as acquired immune deficiency syndrome. In order to discuss the various aspects of this and try to bring some very important information to you, our viewers, I would like to welcome to our program two guests today. First of all is Mr. John Perry, who is a public health advisor with the Center for Disease Control. Mr. Perry, thank you for being so generous to come with you and share with us this important information.
It's good to be here with you.
And I'm happy to welcome back to our program someone who's been here with us before, and she's also very generous with her time to suggest programs that's helpful to our viewing audience, is Jan Palmer, who is a registered nurse and works in the health department of the Panhandle Health District. Jan, as always, welcome to our program.
Thank you, Tony.
And I'm happy to introduce, to ask our first questions, a Coeur d'Alene attorney and regular panel member, JANNEL BURKE.
Let's start with John. Can you tell us something? When did we first become aware of this disease? Is it something that's fairly new, or has it been with us for a long time and we just didn't know it by the name AIDS?
It's relatively a new disease. We first began to experience cases in 1981 that were diagnosed as acquired immune deficiency syndrome.
How was it discovered? How did officials begin to determine that that's what it was AIDS, and give it that name?
They began to have a number of cases of young men in around the New York area and some in California that began to have experienced symptoms that were not common for that particular age group. Most of them, Kaposi's sarcoma, were normally in people over 60 years of age.
Jan, as a nurse, can you tell us a little bit more? What is actually AIDS?
AIDS is a virus-caused disease, at least that's what it's felt at this time. It's caused by a virus. The virus attacks the patient's immune system and makes them unable to fight disease, which is more actually a syndrome than a disease itself. It's other diseases like Kaposi's sarcoma, a very serious form of pneumonia called pneumocystis pneumonia, other more opportunistic infections that actually kill the patient, not AIDS itself. That's a syndrome.
Does it have other medical terms by which you know it?
No.
Or do you just call it AIDS?
We call it AIDS.
And it means that someone then loses their ability to fight other diseases.
That's right.
In terms of history, has that been with us for a long time? Other kinds or similar types of diseases that caused a person to lose their immunities?
Well, we have known that forms of cancer can cause a person to be immunosuppressed. Chemotherapy for sure causes immunosuppression in adult patients and in children as well, much like AIDS does. So we are somewhat experienced, the medical profession is somewhat experienced in dealing with immunosuppressed, but not in the particular case of AIDS.
So then, John, when this occurred, this was something new, relatively new, in 1981, and researchers began to put together, and medical people began to put together that this was happening in a pattern. And it is from that we glean our name AIDS, and also that research and publicity began to be done about the disease. Is that correct?
That is correct. They began to search out and they began to find numerous cases around the United States, primarily in the large cities, that fit the particular pattern that they began looking for.
And so from that, did they determine what might cause AIDS?
They found that about 73% of the cases are either homosexual or bisexual in origin. 17% come from use of intravenous drugs and sharing needle paraphernalia. This is primarily where most of the percentages come from.
I would like to go a little more into depth on the history and follow up on what JANNEL has indicated. As you have indicated to us, 1981 was the year, I believe, that you discovered the first cases that you identified as AIDS. but in some research that I had done, also even prior to 1981, it was believed, was it not, that this particular syndrome problem started in Africa. I found from some of the research that even it was suggested that it possibly started with, I believe they call it the green monkey in Africa. Would you, Jan, take us through that, please?
I know that they have discovered a syndrome similar to AIDS in Africans. It's very common, and it's well established in Africa. The theory with the monkeys is exactly that, a theory. But we do know a syndrome similar to AIDS does exist in Africa.
And it was even prior to 1981?
Yes, much prior to.
One other question on that, and then I want to get into the stages of the syndrome. First of all, it is believed that this particular syndrome, what we call AIDS, has, as we've indicated, not been around a long time. So is it safe to say that prior to 1981 or 80 or 76, somewhere in there, that this disease or this virus really did not affect human beings?
It's difficult to say. I would say, knowing that an incubation period of 2 to 5 years does exist for AIDS, that virus has been around prior to 81, and how much prior we really don't know. How many cases existed before it was really put together as a syndrome?
Is it possible that the period could even be longer than 5 years, that it was even earlier than 1976 or 75? Or
what do you think, John?
Well, there's a theory, and this is strictly a theory. The hypothesis is that we know that the endemic in Africa is AIDS, or a disease called whatever they call it there, and it has the same virus that we're using over here, as the HTLV3 virus that has been isolated. The theory is that workers began going from Africa to Haiti, and they went back and forth. And Haiti is a sort of a resort for people coming out of the New York area, the homosexual group that went there on vacations. They went down there, experienced sexual relations with the populace down there, and then they came back to New York City. And then from there, it has spread out to the other parts of the United States. Now, this is strictly a theory. We haven't been able to prove this yet.
Let's talk about the 3 stages, if I am correct in the research that was gathered. Am I correct that they've identified that first some people, when tested, that they indicate they have the virus, but there are no kind of symptoms or they don't have any problems? Is that correct? Indicate
the presence of the antibody to the virus.
Okay.
That they have at some time been infected with the virus, they have antibody in their system. That's what our test shows.
But it's even possible that some of those individuals would never come down with the AIDS syndrome themselves.
Very much possible. Yeah.
Okay. Then the second stage, if I am correct, is ARC, or AIDS-related complex. Would you describe for our audience what that stage would be like? John?
Generally, it's lymphadenopathy. This is where the lymph nodes begin to swell. People begin to experience some weight loss. They begin experiencing diarrhea, which continues on for a month or longer, and it is very difficult. So they have some fever. Now they might get over this, or it might continue on. It's just what sometimes we call it pre-AIDS. Sometimes they completely, the signs and symptoms leave, but other times they continue on and keep developing.
Okay, then moving from the ARC, there is a third stage, is that right?
One thing before we go on,
yes.
The ARC stage is difficult to pick up on. Those are the symptoms of many, many conditions. And oftentimes hepatitis is indicated, other common illnesses that can cause the weight loss, and the other symptoms that are happening. So oftentimes this goes missed as the actual ARC stage of AIDS.
I'm glad you did that, because we don't want to overexcite our audience. That also, even we've heard of things like the 24-hour flu, and sometimes with that comes things like diarrhea and so forth. Then the third stage is the one that I guess we've read most about, where is it something like 13 or 14,000 people have been in that stage, and that stage is fatal. And would you describe what happens that, and if there is any possibility from the research you have of one surviving the third stage?
During the third stage, the person is no longer able to fight disease Two of the most common infections that the person acquires is Kaposi sarcoma, which is a form of cancer very commonly found prior to 1981 in men of Mediterranean descent that are over 60 years old, and it was not a fatal disease, or felt to be a fatal form of cancer. Kaposi sarcoma found in AIDS patients is extremely fatal and is happening in patients that are 20 to 40 years old. And that's what I think clued a lot of our health professionals, that something else was going on. Another common disease that we see is pneumocystis pneumonia, which is a very difficult pneumonia to treat. And antibiotics, they're doing much better in treating it now. People are surviving this form of pneumonia. But prior to the last year or so, they were not.
John, after one is diagnosed as being in stage 3, what is the life expectancy for most individuals if one of these diseases has set in?
Probably six months to 2 years. And they go through a crisis like Jan mentioned. They treated for pneumonia, and we can probably get rid of it for a period of time, and then they go down and have another crisis, and they'll come out of that, and then they'll just gradually go down because their immune system is not working and not functioning, and so all we can do is try to take care of them the best we can with the drugs that are available and other medications that are to try to help them through this particular crisis.
In addition to those two major diseases that come out of the loss of one's immune system, could you identify some others that are less often found but are things that AIDS patients have?
And commonly we see tuberculosis, we see what we call systemic yeast infections. This is where they have yeast in their blood, in their mouth. There's, the yeast basically overruns their body because their immune system cannot fight it off. And that's just a classic example of an immune deficiency, where a patient cannot fight something that everyone else has normally in their body, and the AIDS patient cannot.
Finally, I also read that in addition to losing the immune system and those things such as tuberculosis setting in, that it also is believed that it affects the nervous system and also the system into the brain. Do you have any information on that?
I don't.
No, not at this time.
Okay. JANNEL Burke.
I would like to pursue a little bit more what causes AIDS. We talked just a few minutes ago about some of the causes, John, and maybe you could expound a little bit on those. Some are thought to be through the use of common needles, for example. You mentioned other ways. Can you give some more information about the causes of AIDS?
The cause, we don't really know what the cause is, do we? Maybe
other than the fact that the virus is
the virus
is there,
okay,
right?
Let's start with that. And what is a virus in comparison to some other kinds of things? In other words, is it a
virus has
bug?
the virus has been around a long time. Herpes is caused by a virus. HTLV-3 is a virus.
The common cold is caused by a virus.
There's other, the HTLV-2 and the HTLV-1 are all viruses that they've isolated for other diseases. So the cause is we feel it is a virus, and it gets into the system and it begins to break down the system is what happens.
Then my question perhaps should be, how is this virus transmitted?
Okay.
Primarily through intimate sexual contact with someone that already has the disease.
And that person may be someone in any of those stages that we mentioned previously, first, second, or third stage. So someone in the first stage who has not yet exhibited symptoms may be carrying the disease.
It is felt to possibly be infectious, yes.
The trouble is that we haven't been able to document when they're shedding that virus, we might say. We don't know when they're shedding that virus, whether it's in that first primary stage or whether it's in the secondary stage or in the tertiary stage, which is the third stage of the disease. We suspect it's probably when they probably have least signs and symptoms, and maybe before.
Mm-hmm. But it does appear that it's a communicable disease, one that spreads from person to person.
Yes.
Intimately, sexually.
Or by blood products.
By blood products.
Is it felt that the virus is one that is attached to the blood in some way?
I believe
they've located it in the blood,
yeah.
yes. And that's why they're testing now all blood products that go through the Red Cross blood banks and other blood banks, I'm sure, are testing for the disease, or not for the disease, but for the virus.
Now, you've mentioned that it's communicable through sexual contact. Mm-hmm. And would you please clear up whether it's a homosexual only or bisexual as well contact?
Well, it's felt to be spread by intimate sexual contact, both homosexual and heterosexual, although we're seeing the indication in the homosexual population, in the gay population, and more so in that population than in the heterosexual population right now. But it is felt by researchers that we will see more in the heterosexual population.
Is there a theory as to why it's found more often in the homosexual population?
I think a lot of it is based on the lifestyle of the gay person and their exposure to sex partners, often anonymous partners. And this is back several years ago. I don't think that that's continuing now with the AIDS scare. But knowing the sexual practices of gay men in particular makes them more likely to pick up the virus.
Now, John also mentioned transmittal through blood products, perhaps a needle used for some kind of a drug.
Mm-hmm.
Can you tell us a little bit more about that possible means of communication?
As people use the drug paraphernalia, the needles, they generally don't sterilize their needles like they should, and they pass it from one person to the other person. And if one person has the AIDS virus and they've just completed the act of intravenous putting the drug into their veins, then they would pull it out and give it to the next person, which they would then use that needle, and the blood would still be on the needle. So this is primarily where 17% of the cases are coming from, or from that group of people.
And I think it's pretty much determined that's repeated IV drug abuse.
Mm-hmm.
You know, it's not one time, it's repeated use and repeated exposure to the virus.
What about, there have been some well-publicized cases of blood transfusions.
Mm-hmm.
Jan, do you have a comment about the possibility of transmitting the disease through blood transfusions?
I think
and some of us are
Sure.
fearful about
I think prior to the availability of the HTLV3 testing, the testing for the antibody in the blood, it was something that we all thought very seriously about before receiving a blood transfusion. Since that test has been available, all the Red Cross blood banks have been using that test routinely screening. And in fact, they're using a test that probably shows some false positivity, so we're even throwing out a little good blood to make sure that we do find all the blood that is contaminated. And I don't believe, since that test has been available, that there have been any cases of AIDS. Granted, it takes some time to incubate it, but I don't think we will see that.
I would like to direct this to John, and I think one of the purposes of this program was we've already accomplished discussing it and some of the stages and so forth, but the literature indicates, in television programs in particular, that there is a hysteria that has swept the country, and the rumor mill has indicated that anyone who might show that they've been exposed to the virus, that they in turn can spread that to others simply by being next to them, shaking hands, hugging, whatever it might be. Would you address that to our audience who are so fearful that it's like the virus for a cold, that if you're in the room with someone who has a cold, that you can also get the cold?
Mm-hmm. Researchers have had a difficult time identifying the virus from the saliva or the tears. Perhaps people have heard that they've identified it from the tears of a person. They had to work and struggle to try to identify it. About the only time that something would be spread through the air would be the tuberculosis germ that the person that had AIDS might also have at that same time. We have no cases, documented cases, of anyone catching AIDS or AIDS-type diseases from normal handshake or being in the room with other people. Or we have all the healthcare workers that have taken care of these 13,000 cases that we've had in the United States. We don't have anyone that has developed AIDS.
So it's very, very important to let the audience know that, and Jan, you would concur with this, that at this time there is no evidence at all that people get the virus from any casual contact at all.
That's correct.
Okay. In relation to that, then, I would like to ask you if individuals in our society should be, obviously one should always be concerned about all diseases, but that they should be more cautious in what they say or how they suggest that individuals would act in behalf of such things as medical care.
Mm-hmm.
Okay. Another area I want to get back to JANNEL. Also, some programs that are being aired, that some advice is being given to individuals who are the most subject to the AIDS. Would you like to take this opportunity, either John or Jan, to talk about any safety measures that should be taken to try to lessen this really terrible disease? For example, before you answer the question, I saw a statistic last week indicating that there are some positive signs that have just come out from our major urban areas, that there seems to be a declining number of cases that are being reported, that we may be turning the corner. I say that with some caution, but there's some statistics. So based upon my long elaboration, what kind of advice would you have for groups of people to try to prevent this?
Well, speaking in terms of counseling gay men that I do in our clinic at the health department, we talk a lot about safe sex, what sexual practices they can maintain to provide them with the most safety from AIDS. This is limiting their partners, using rubbers if possible. You know, that's surely what we advise them to do. And just to keep their contact with other persons in a safe realm, no blood contact, no tissue destruction or anything else that might pertain to their sexual contact.
Okay. JANNEL BURKE.
As the average person on the street, what kind of advice would you have for them in terms of if they're traveling, if they're eating in restaurants and so forth? What kinds of advice would you have to them in terms of the AIDS hysteria, the AIDS scare that has grown up? John, would you like to do this?
Well, we know that the virus is killed very easily with just a bleach solution, so I would think that, you know, if restaurants are using a bleach solution or a strong detergent in their soaps, that they're not going to be any problem there, because the virus has to be there, and it has to be, as we've talked about before, the only way that it's spread is through intimate contact, and this is generally sexual contact with the person. So a person could go out to eat and to talk to people and shake hands with people without any problems, without having to worry about being at high risk.
Jan, following that one step further, what about a person who has an AIDS person in their family? What about someone whose family may have someone with AIDS? What kind of advice do you have for them?
Well, I think that the CDC has pretty much determined, that's the Center for Disease Control, that the person with the antibody in their system is potentially infectious. But like we've said before, and I'll reiterate again, it's intimate sexual contact or blood contact, and so a household contact is not going to be at risk. We have seen some children that have come down with AIDS, and it was felt at one time that that was by close household contact. But I think it's been since determined that the mother of that child was HTLV3 positive while she was pregnant. The child has then later determined to have AIDS. And it is the policy now for all health professionals to discourage pregnancy in women that are HTLV3 positive.
John, in terms of school, then, some school districts have set policies, and in the state of Idaho, I believe a policy has been set. Can you tell us what that policy is, and then elaborate a bit more on whether or not it's dangerous for a student with AIDS to attend school?
The student that has AIDS would probably be more at risk than the other students that he or she is going to school with, because every child has the cold or every child has the flu, and this would compromise their system more. So the parents wouldn't send the child to school because they would just be compromised more and more. We sent out some guidelines. Each individual school district is going to have to make that determination. I think it's going to be a case-by-case type situation. If the child is able to take care of themselves, they're not getting in fights with other children, so that any blood products might pass from one child to another child, then that child is probably the only risk is that they'll probably catch something else that will compromise their system, and they'll be sick. And basically these children are going to be very ill, so they probably won't want to go to school because they won't feel like going to school. So I don't think we're going to have to worry too much about that.
But what you're saying then is that there's a limited amount of danger in terms of the other students catching
right.
AIDS from a student who might have AIDS. Can you give us some idea then of the number of people in Idaho who have been diagnosed as having AIDS? And maybe also some Washington statistics, if you have that, because we have a number of viewers from Washington. Let's start with Idaho, John, and then maybe Jan, if you could fill us in on Washington.
There has been no diagnosed cases in the state of Idaho at the present, as of today. I haven't called my office this morning.
If someone is diagnosed as having AIDS in another state but returns to Idaho, let's say, to be with their family and so forth, are you then kept aware of that? Do you get that information in your office?
We sometimes get it through the grapevine. Other doctors will call in for information to our state health officer asking what can be done or what suggestions that he might have to offer to that person.
But normally in the process, it's the diagnosis that is reported. Is that correct?
That is correct, and that's generally in the other state, and people, sometimes they will come home.
And we have seen quite a bit of that in Idaho. We've had a lot of people come home to family. So we've had deaths due to AIDS, but no actual diagnoses have been determined in the state of Idaho.
And can you give us some facts, perhaps, about Washington?
I believe Spokane County has had 10 cases of AIDS diagnosed. At least that was the last I'd heard. That's probably a couple of weeks old. And they are, continued on their AIDS alert, watching for other cases and hoping those cases will be reported.
And basically, then I would suppose it would be true that they have a number of people who come home to their families, too, in
sure
Washington.
They do.
We're just about out of time. I have two other quick things that I would like to ask. One of them is, do you have any evidence of anyone who's in stage 2 or 3 that we've talked about today, that for some reason the virus goes away and they do recover and get their immune system back?
I believe there are documented cases, and this may not be totally accurate, but this I understand from in fact, one of my gay patients has told me this, that the continued exposure, the patient continues to be positive HTLV3. When the exposure stops, a couple of cases have reverted to normal. So that potential is there.
And we're just almost out of time, but in the research, is there any promising things on the horizon about a possible cure?
They're trying different drugs, different types of drugs, but we haven't had anything that does the curing or the healing
at this point.
At this time.
I just wish we had more time to pursue that, but I want to thank both of you for coming. You've been kind with your time and you've been most informative. And Janelle, thank you for your fine questions. Ladies and gentlemen, our guests have been John Perry and Jan Palmer, who are specialists and advisors in the area of disease control, and we have been talking today about acquired immune deficiency syndrome, which is a very, very serious and important topic. We hope this information has been helpful to you, and we'd like to invite you to be with us again next week when we again will talk about something that we think is important to you, as we try to do each week. I would also take this opportunity to invite you to write to us at North Idaho College in Coeur d'Alene, Idaho, 83814, and we will respond to all your inquiries. Please have a good week. I am Tony Stewart.
The North Idaho College Public Forum can be seen at this same time each week over this station. This production was videotaped earlier by a North Idaho College student crew for viewing at this more appropriate time.